Good afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan to give our weekly update on COVID-19. What we have continued to see as we come to the end of the month is the Delta variant is a stubborn animal when it comes to infecting people. As Dr. Bogan will give the update that the the case rates remain consistent over the last week. But we also know the effectiveness of the vaccine continues to prove very effective in keeping us safe and keeping down hospitalizations and fatality rates among those who have been vaccinated. So we continue to see more and more people vaccinated, but we've got to get a lot more to protect this community, protect our families, and protect each other. So let me turn it over now to Dr. Bogan to give her weekly update. Dr. Bogan?
Good afternoon. Thank you, County Executive. So very little has changed since last week. We continue to have on average about 400 cases a day, and the positivity rate is also unchanged at about 6.2%. We do continue to see an increase in preventable hospitalizations and deaths from the virus. Our case investigators continue to trace cases back to public gatherings like sporting events, concerts, parties, etc., where the majority of people are neither masked nor distanced. Although older populations are the most vulnerable to this virus, it's not just seniors whose lives are severely impacted by COVID. It really could be anyone. If you're young and healthy and you get COVID, there's a very good chance you'll be fine and that your family will be fine. You might not even feel any symptoms. However, you might not be fine. You might get seriously sick or die. In the month of September alone, we have had 5 deaths in the 25 to 49 age group. These are young folks. Why take the chance? The vaccines are effective at preventing serious illness, and they're free to us. There is no out-of-pocket expense to protect yourselves, your family, and your loved ones, your coworkers, and your community. Getting vaccinated saves lives and keeps hospital beds open for others who need them. If you need assistance to get a vaccine or schedule a vaccine, please call 211. They're happy to help. As for the rest of my comments, I'll be brief and offer just a few reminders. First, with regards to booster vaccines or booster shots, we've had a few inquiries on this, and I'll reiterate that we are ready to administer shots, as are the other vaccine providers in the region. Last Friday, the CDC issued recommendations for the Pfizer Biontech booster doses. They recommended that booster doses be given to those who received their second dose of their Pfizer primary series at least 6 months ago and are in one of the following groups: people aged 65 and older and residents in long-term care settings, people aged 50 to 64 with underlying medical conditions. It's also optional for people aged 18 to 49 with underlying medical conditions, or those aged 18 to 64 at increased risk for COVID-19 exposure and transmission because of occupational or institutional settings based on their individual benefits and risks. Local pharmacies, our federally qualified health centers, doctors' offices, the health department, and others are already giving booster doses. According to the state dashboard, more than 14,000 Allegheny County residents have already availed themselves of the option to get a booster dose. If you are unsure, I recommend that you talk to your healthcare provider about booster doses for you and your particular situation. I also want to mention that last week the health department released the September vaccine report, which is available online along with many other COVID resources at alleghenycounty.us/coronavirus. Speaking of vaccines, this morning the county executive and I received our seasonal flu vaccines from one of our fabulous county nurses. Last week, the health department held a flu clinic at the county courthouse, where I am pleased to report that over 4 days, our staff gave over 500 flu shots. We're starting to see flu cases in the community, so please don't wait. Go get your flu shot. You can get your shots at any number of places. Like the COVID vaccine, you can get them at your doctor's office, at federally qualified health centers, pharmacies, or the health department's immunization clinic downtown. If you haven't gotten your COVID vaccine yet, you can get them at the same time, the flu vaccine and the COVID vaccine together at the same time. I'll offer my final reminder to everyone to please follow CDC guidelines on masking, which means wearing your mask when indoors and also outdoors in crowds and when you can't physically distance. Just like vaccines, I'm going to say it again, masks do work. So please, thank you, be safe, and be kind.
Our first question today is from the Pittsburgh Business Times. How is the booster shot administration, both from the county and just around the county, going? What has been the demand and how is the supply? Are there any challenges?
We have had plenty of doses. It's being offered all over, like I said in my comments, and it seems to be going well. We haven't heard any complaints. We haven't heard of people being overrun with requests, but it seems to be a steady flow of requests, but not overwhelming the system.
What are the county's preliminary plans for the administration of the COVID-19 vaccine for children if and when it is approved for use?
Just like the boosters, there'll be many providers out there offering vaccines. We and others will work with schools and community organizations to make sure the vaccine is widely available.
This next question is for the county executive. What led you to make the decision now to make the vaccinations required for county employees? And can you tell us what will happen December 2nd for those who do not comply?
Well, the one thing we've seen week after week, month after month, is the effectiveness of the vaccines. And the best way to get back to normal is to have everybody vaccinated. So our county employees who have done a great job throughout COVID are there. We're here to serve the public. In addition to our coworkers that we want to make sure are protected, we want to make sure that the people that we serve are protected. So a little over a month ago, we made the announcement that any new hires would need to have a requirement of being vaccinated, and those that were unvaccinated that were working with the county had to be masked and get constantly tested. Since then, we've just kind of made the decision, following along with a lot of other organizations, including the federal government. President Biden made that announcement a few weeks ago as well, that the best way to protect all of us is to be vaccinated. And also, we know that even if you're vaccinated and you have young children at home, your coworker who's unvaccinated may give this, spread this virus to you. And unfortunately, the children from, under the age of 11 are unable to be vaccinated at this point because it hasn't been approved for them. So there's a number of factors, but we feel very comfortable that this is going to help protect people, protect our coworkers and each other, and protect the public.
This next question that we have is from Spotlight PA. Are there any plans in the works or in place to do big booster clinics like we saw in the winter?
We are really considering all options at this point. We don't have any definitive plans at this time.
This question also from Spotlight. Will the department be doing outreach or coordinating efforts to reach populations that previously had trouble connecting with the vaccine?
We continue to outreach to communities through our community-based organizations, through the federally qualified health centers, to faith-based leaders, and to anyone else who wants to partner with us. And I, again, tell people, if you're aware of a community in need, please call the health department and let us know. We remain open to suggestions and collaborations.
And this final question, also from Spotlight, is for the county executive. You have previously mentioned some possible concerns around a vaccine mandate for county employees when it comes to collective bargaining agreements. Have those issues been resolved?
Well, we certainly work through our county manager and the HR department and the law department, and they'll be handling any of these issues that come up. And as I said previously, we understand this is a public safety issue, and following the agreement of the CDC, the Pennsylvania Department of Health, Dr. Bogan, and the county health department, the FDA, and OSHA, we feel very comfortable with where we're going with this. This pandemic has been stubborn, but we know what the effective treatment is. It's the vaccine. The vaccine has been very, very effective, and I do appreciate the fact that so many folks out there, our health organizations as well as the health department, have plans that have already been utilized to get people vaccinated, also for the booster shots, and then the plans moving forward when the children under the age of 12 are approved. So let's keep that level of cooperation going and keep everybody healthy.
And I apologize, that question was actually from WESA. That was the final question, if there's any final closing remarks.
Well, thank you again, and let's continue to get everybody vaccinated. Let's get healthy, and again, we appreciate everybody's level of cooperation and the health department continuing to do great work with all of our partners. Thank you. Have a good week.
Our next regularly scheduled briefing is Wednesday, October 6th at 4 p.m. Thank you for joining us.